name is Beth Scalone, and I'm from North County Water and Sports Therapy Center in San Diego.
How's it working for your practice?
It's been great. Patients love it. My staff loves it. We like the versatility of it. We can do core work, upper extremity, lower extremity, and then get the core in there at the same time, so it's multitasking. The Stix themselves help us get some stability. If somebody's a little imbalanced in the single leg, they can still work their core and have that stability without having those external stationary sticks.
That's right. And being able to get your patient down on their feet, what's the benefit of doing that?
Well, that's how we function. We got to stand. We got to control in 3 planes our muscles, and and mostly we see a lot of backs and hips and knees, and got to be able to control that in all 3 planes. And it's hard to do that when you're sitting down or laying down because we function standing.
What are some of your favorite exercises on core Stix?
I love the single leg deadlift in all its versions. The hip abduction is kind of my favorite. I'm a big glute med person, so pretty much all of them. The push-pull for both back, shoulders, hips, and we'll do that bilateral and single leg. And I like stir the pot. Again, another really great core, integrating our upper extremity patients for an integrative exercise program. As physical therapists, we are looking at motion control and getting people back to life. So it really doesn't matter what you can bench press in the gym. It really matters whether you can push and pull the items, your grocery cart, pick up your grandkids, or the high-level sports. And so we have to kind of reproduce those muscle activations in rehab to get them back to that.
And how does core Stix work for that objective?
Well, again, core Stix, we work in those functional positions. You're standing. If you can, you get to use your core for those functional activities between the lower extremity and the upper extremity. So I think it allows us to reproduce that in an effective manner in those functional positions. Neuromuscular re-education is something that we do a lot of, and that's the sequencing of muscles, the right firing of muscles, and trying to dampen down those muscles that are always overused. I call them the big stupid muscles. They're the ones that constantly turn on, and the core Stix allow us to set the people up to facilitate maybe those weak or inhibited muscles, aka the glutes and the glute medius, and those are kind of a common muscle. I call it gluteal amnesia. A lot of these exercises really let us have that person find those correct muscles and work on those without firing excessive overused muscles. So we see a few patients with quadriplegia, incomplete, and paraplegia, and they're several years out, but the incomplete quadriplegic patient, we use it for sit to stand to assist, so that we have an extra set of hands. So he uses the Stix almost like an assisted squat, but then I can have my hands at his knees or hips and try to really guide him so we get good quality of motion. And my paraplegic patient, we can do some great seated core work. We're working on leaning forward and back so that she has stability and can pull her wheelchair in and out of the car, but right now she's got to hold on because she doesn't have enough extension strength. So it allows us to do that safely, and again, my hands can be somewhere where I can facilitate the motion I want.